Hi, I'm Dr. Tony Mork, author, speaker, inventor, board-certified orthopedic surgeon. I'm also an endoscopic spinal surgeon, my practice being dedicated exclusively to the treatment of chronic neck and back pain with endoscopic spinal surgery, which I've been doing over the past 13 years. Today, I'd like to talk about the 4 main causes of chronic neck and back pain that can be addressed with endoscopic spinal surgery. Over the past 13 years, I've had a lot of time to think about causes of neck and back pain that can be addressed using endoscopic spinal surgery techniques, and I found that it really comes down to 4 particular things. On a larger view, I think the confusing things about the whole business, since you've got to work through a very small incision, is trying to pick and choose. So if a problem is a single level problem, whether it's stenosis or a disc herniation or disc problem, it makes things a lot easier. Things become more difficult when we have a multi-level problem in which we've got to pick and choose where the pain is coming from. And this is confusing because these pains, they can radiate to different places in the back, the buttock, and leg, and people really cannot discriminate between the kinds of pain. And people can't say, oh, that's a facet or that's a disc type of pain. All they know is it's pain, it hurts, and that's what they can figure out. So multi-level issues become more problematic and oftentimes have to be sorted out with some type of spinal pain mapping, which is a discussion of a different time. The number one cause of that can be treated endoscopically for the back and neck is spinal stenosis. And spinal stenosis is a true mechanical cause of pain in that stenosis is a narrowing of a canal, and the canals are, they are allowing the nerves to pass through. Well, if you've got too tight of a canal, and for a number of reasons, bone spurs, overgrowth of the bone from just genetic reasons, a disc herniation, thickened ligamentum linings of the spinal canal, any of these things can give rise to a tight canal. Tight canal then sits on top of the nerve, and the nerve will give you a sensation of pain, numbness, or weakness in more exaggerated cases. So, I think that spinal stenosis, or whether it's from a bone spur or what, can be very satisfactorily relieved with endoscopic spinal surgery decompression. So this is the number one thing that can be relieved with endoscopic surgery. So it's endoscopic surgery, not just a soft tissue treatment. It actually is able to relieve bony conditions like spinal stenosis. So the second major cause of neck and back problems are we're going to see right here, disc problems. And disc problems are common in both the neck and the back. They cause 2 types of problems, either deep midline neck or back pain, and they can cause pain down into the cervical, into the shoulders, arms, and hands, or in the lower extremities, feet, thighs, legs, buttocks, because of pressure on the nerve. The discs can give rise to 2 types of pain. One is deep in the middle, and we call it axial pain. And the other pain is radicular or down the extremities. And this works because the disc can be either stretched, the covering of the disc, the annulus is very sensitive, and if there's any stretching like some disc material trying to get out and expanding the annulus or the covering of the disc, this can cause local pain. If a piece of disc material gets out and actually pushes on a nerve, then you can have pain that goes down the arm or the leg into the foot. Remember, the pressure exerted by the disc fragments gives rise to 3 symptoms: pain, numbness, and or weakness. So when a disc pushes down too hard on a foot nerve, then you can end up with say, foot drop, for example. Disc problems, very treatable by endoscopic means, oftentimes able to get into the disc space without any violation of the spinal canal or the actual bone that contains the spinal canal. So these are very treatable by endoscopic techniques. The third main cause of neck and back pain, facet syndrome. And facet syndrome is the guiding joints in the back and either having arthritic problems from bone-on-bone contact. There can be stretching or pinching of the soft tissues that surround the facet joints. and invaginate the little joints themselves. Oftentimes this is a little bit older person's disease. It gets progressively more common as people are over the age of 60, and accompanies degenerative disc disease where there's actually narrowing of the disc. People will then get the facet joints in the back getting off center with the accompanying pinching or arthritic changes to accompany this. These problems, and I've written a paper on this with my partner, Dr. Scott Hoff, noting that 2/3 of the time pain can be significantly relieved on a permanent basis by utilizing a laser to divide the nerves that go into the facet joints. And it works well for the lumbar, thoracic, or cervical levels. So that would be the number 3 cause, and which is treatable by endoscopic techniques. The 4th main cause, and not of neck, but of really low back and buttock pain, sometimes into the legs, is sacroiliac joint pain. And we oftentimes think of the sacroiliac joint, but what we found is that this particular problem is oftentimes a soft tissue problem where there's a little spur sticking up from the pelvis or from the sacrum and then into the tendon, into the tendon that's inserted from the big back muscle groups. This little tendon, this little spur inside of these tendons can give rise to buttock pain and even pain that goes down the leg, and is, in my opinion, one of the most common causes of pain that goes down on the buttock and legs with a normal MRI. So people, they come in, they're maybe 50, 60 years old, they have a normal MRI, but they've got leg pain. This is something I always do check out. It is very amenable to treatment with endoscopic spinal surgery, and release of the tendon and removal of the spur oftentimes results in a significant reduction of this type of pain. Well, there you have it, the 4 main causes of neck and back pain that can be addressed with endoscopic spinal surgery. Thank you for listening, and any comments, just give me a thumbs up, comment if possible, and if you've got any further questions, please don't hesitate to ask or visit me at drtonymork.com. Thank you.